Welcome to Health Professional Radio. I'm your host, Neil Howard. Glad that you could join us for another segment. We're going to be talking this morning with returning guest Christina Korines. She's a Parkinson's patient, and she's going to tell us about a brand new awareness campaign called Newly Diagnosed, Building a Better Life with Parkinson's Disease. How have you been, Christina? Glad to have you back. Thanks for coming.
Oh, thank you so much. I've been okay, thanks. How about yourself?
Been doing well. This morning, we're going to talk about a new awareness campaign. First of all, give our listeners a bit of background about yourself briefly, and then we'll jump right in.
Well, I'm Christina Korines. I'm 35 years old, a mother of two little girls. And when I was 33 years old, I was diagnosed with young onset Parkinson's disease after an 11-year struggle of getting a diagnosis. So my symptoms started when I was 22, and at 33, I finally got my diagnosis. I've been in treatment on and off with lots of changes for about 2 years, and I think we finally found a steady plan for myself to go forward for at least the time being, because the disease is constantly changing. But, it's a struggle, but every day is different, and you just look for the good in every day.
Now, you said that you had gone through an 11-year struggle with misdiagnoses until finally a proper diagnosis was made. Talk to our listeners about some of the struggles once you were newly diagnosed.
I think the biggest struggle was getting the actual diagnosis, waiting for them to figure out what was going on. Because I think when you're 22 and showing these symptoms, it's really hard for them to understand what's happening. I believe 10% of people are diagnosed under the age of 50, and I was in my 20s when I was trying to figure out what was going on. But everybody asked me, how'd you feel once you got the diagnosis? And I feel like the only answer I can truly give is relieved. It was a blessing. It was an answer. It was a reason. It was at least something for me to work for and work with and understand and, to work towards. When they're telling you it's nothing, that was frustrating for me, because I'm like, no, it's something. I know my body. This isn't in my head. But it was a relief, in other words, when I finally got the answer.
Now, according to the Parkinson's Foundation, around 60,000 people or so are going to be newly diagnosed every year here in the United States alone. When people are newly diagnosed, what can you tell them about how to deal with it? We've got this new program called Newly Diagnosed. Tell us about this program.
So I think it's difficult when you're newly diagnosed. I'm assuming with anything, but I'm very grateful. My doctor's incredible, and he's been a really good source of, support and community for me. But it's kind of like, hey, you have Parkinson's, and then they close the door, and you're like, all right, what happens from here? And you feel kind of alone. I've been very blessed with having the connection with the Parkinson Foundation. It's a sense of community. It's a sense of, they say it takes a village for raising children, and I honestly believe that it also takes a village to get through this diagnosis. So they have this great sense of the community, and if you look at their website, they created a new page for just people who have just gotten through the recent diagnosis. I partook in a very, very informative video with other people who've been newly diagnosed. I'm pretty sure they consider new diagnosis within 2 or 3 years. But it was just a very cool experience to meet other people who are going through this. And, I know for my husband, who is my primary caretaker, it was cool for him to be able to meet other people, other wives, other husbands of, Parkinson's people. So he was able to have that connection. For me, just the biggest thing that you could get from this newly diagnosed awareness campaign is a sense of community, a sense of hope, and some foundation for what's going on with your body and the rest of your life, because this isn't something that's going to go away.
In this Newly Diagnosed, Building a Better Life with Parkinson's Disease, you spoke a lot about community. I'm assuming there are lots of resources, lots of tools having to do with the Parkinson's community. But what about some of the tools when you're by yourself? Are these tools and methods to cope, are they included in this new campaign as well?
Well, I know that there's a lot about emotional support and just having a great mental health awareness. A lot of people don't talk about the mental health aspect and the struggles that come along with Parkinson's. Most people who have this are either depressed or have anxiety. So it teaches you how to take care of yourself. You have to live a very healthy lifestyle with this disease, and it gives you a lot of information on things that you can do. It gives you resources and places that you can connect with. You don't realize how much your mental health is affected by your physical health, and especially with this disease. So there's a lot of great resources for physical activities and things that you can be doing, yoga, boxing, rock steady, all those programs that they do that are really, really helpful for people who are living with this.
John, does the newly diagnosed Building a Better Life with Parkinson's Disease campaign talk to healthcare professionals about addressing the problem where, about 50% of folks who leave the doctor's office after a diagnosis don't have the tools or resources to actually manage and maintain in the early days of their diagnosis?
Yeah, that's a very key component of this. So as you suggest, we know that people will go to the doctor's office, they'll get a diagnosis with Parkinson's, and then they will often leave without any information. So part of our campaign is to help inform patients and care partners, but also to help provide information and resources to physicians, nurses, the full gamut of healthcare providers who are involved in the care regimen. What we know is that people with Parkinson's who leave the doctor's office not only with their diagnosis and maybe a prescription, but also directives to how to connect with the Parkinson's Foundation through our website, parkinson.org, or through our helpline, 1-800-4PD-INFO, that their course of disease is going to be easier. I mean, not to say that Parkinson's is ever easy, but they will have access to resources and information that can help them in their journey. And so, letting providers know, healthcare providers know that is really critical.
Now, once again, a website, the website where our listeners can go and get more information about newly diagnosed, Building a Better Life with Parkinson's Disease, and about Parkinson's in general, as well as the Parkinson's Foundation.
Yeah, so it's parkinson.org. That's our website. And then 1-800-4PD, as in Parkinson's Disease, info. And we have highly trained people on our helpline answering calls. And, they have various degrees from nursing to social work to physical therapy. And they are available for calls during business hours, coast to coast in the United States. And calls can come from anywhere.
Well, I thank you both for coming back here with us on Health Professional Radio, and hoping to speak with you again as more awareness campaigns and tools and resources for those living with Parkinson's are made available. Thank you both for joining us this morning.
Thank you very much.
You've been listening to Health Professional Radio. I'm your host, Neil Howard. Audio copies of this conversation are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes. Listen in, download it, SoundCloud, and be sure and subscribe to our YouTube channel at youtube.com, Health Professional Radio.